how in implementing this strategy, the authority will strive to address all the opportunities and challenges while also achieving tangible outcomes in occupational safety and health, accreditation, chemicals, and market surveillance. When each of the panel members have presented, there will be an opportunity for questions and answers. So you can submit your questions in writing through the Q&A function, which is on the bottom right-hand side of your screen. If your question is for a particular panelist, please reference that at the start of your question. And you can submit questions at any point, so don't be afraid to get typing and get them into us. So without further ado, I'll invite Minister English to unmute his microphone and commence the launch of the authority's strategy statement. Gurmila Mahada.
Thanks, Kevin, and good afternoon to everybody and to all our viewers and listeners, and Happy New Year to everybody. First of all, I want to say that I'm delighted to welcome and to officially launch the Health and Safety Authority's new Statement of Strategy for 2022 out to 24 and its programme of work for 2022 as well. It also takes the opportunity to acknowledge the work and dedication and determination by Dr. Sharon McGuinness and everyone at the Health and Safety Authority, especially last year in continuing to act as the lead agency in monitoring and working on the work safety protocol and in assisting employers to keep their business operating safely and their workers safe in the context of COVID-19. I know, Sharon, you had another meeting in that sphere again this morning as well, which just finished as well. So that's essential work for the last 2 years, but certainly over the last year, as we've had to update that safety protocol quite regularly as well. So in particular, the additional advice and guidance produced by the HSA and the resources of the contact centre have been a very practical support for employers and employees across all sectors. And I've got feedback from talking to employers as well who've engaged with your services. Ireland and the EU are still in the process of dealing with the pandemic, which has had an unprecedented impact on society, on workplaces, on employment, and probably on everyone's lives. The HSA has developed this strategy in the context of the rapidly evolving external factors and shaped in particular by the pandemic, but also with a look to the future and certainly recognising that we'll be able to move on early this year out of COVID again. The work of the Health and Safety Authority is very broad, and Kevin just touched on some of the areas there. So while traditional occupational safety and health issues are still a core focus in this strategy, the broad scope includes a much wider range of activity, including ensuring the free movement of chemicals on the internal market. Apologies there. On the internal market, product safety and market surveillance. Also on the international market, product safety and market surveillance, the protection of all citizens from the use of chemicals, and through the Irish National Accreditation Board to accredit organisations to international standards for technical competence. This new strategy sets out a range of goals in relation to each of these and other key areas. The ongoing prevalence of COVID-19 will have longer term implications with regard to incorporating the public health considerations into the workplace, as well as the wider infection disease prevention and control, particularly for sectors such as healthcare. In addition, the acceleration of the remote and hybrid working during the COVID-19 pandemic means that there's been a refocusing of occupational safety and health considerations. And again, a lot of employers need a direction and engagement and advice on that too, and that's where the HSA also come in as well. Changes in work practices, technology, and innovation, both in the near and longer term, such as the increasing use of artificial intelligence in the workplace, also brings many challenges for occupational safety and health. Also, the ongoing uncertainty of the UK exit from the UK will present the UK exit from the EU will present challenges for the HSA, particularly in relation to increased demand for accreditation and the requirement for increased market surveillance of products coming from the UK. And I recognise the extra workload that HSA have had to take on over the last couple of years, both in preparation for Brexit and since it's been implemented as well. In relation to accreditation, a new national strategy for accreditation 2022-26 will shortly be published. I am pleased to see that the Irish National Accreditation Board, as a key part of the HSA, will promote awareness of the accreditation and broad-based engagement to enhance recognition and understanding of the economic benefits of accreditation. The main challenge now is ensuring that both employers and workers are well prepared for the changes ahead, and that the level of preparedness is spread evenly across the different demographics, genders and sectors of society. Also published today is the HSA's programme of work for 2022. It is an ambitious and far-reaching programme of work, and I am confident that the authority will continue to carry out its work with the high levels of commitment and professionalism that we've come to expect over the years. The HSA's new strategy and programme of work provides us with a roadmap for embracing change and for strengthening the occupational health and safety response to that change. The pragmatic and consultative approach enshrined within Ireland's occupational health and safety regime provides a strong basis for collective decision making and takes account of how businesses operate and how workers work in the workplace. This contributes greatly to the work becoming sustainable over the life course. And this sustainability has been accelerated by the workplace response to the COVID-19 pandemic, particularly in the context of employers and workers embracing remote working for good public health reasons. As we move into an era of exciting change to the ways of working, while it will present challenges to government, public bodies and individual employers and workers, it also brings greater opportunity for wider economic and societal benefit and positive impact on worker health, public health and climate change. So finally, ladies and gentlemen, and to conclude, I would like to extend my best wishes to everybody for the new year, and that your work in 2022 will be healthy, safe and fulfilling. And I want to again thank you for your time this morning, and thank the HSA for your ongoing commitment and work with the national response to the COVID as well. I look forward to continue to work with you through the department here in the years ahead. So I'll hand you back over to our Chair, Tom Coughlin.
Thank you, Minister. Good afternoon and welcome to the launch of the Health and Safety Authority Strategy 2020 to 2024. In particular, I'd like to thank you, Minister, for joining us today to launch the strategy. The preparation of an organisational strategy affords the opportunity to examine where we are as an organisation, to identify our strategic objectives, to map out how we'll deliver those objectives, and to set out the methodology to measure our performance. When you read our strategy, you will see that we have addressed those matters in a clear and concise presentation. When we prepared our previous strategy, we determined that our organisation would become more adaptable, more innovative, more collaborative and more responsive. And COVID and our experience over the past 2 years has driven the organisation further in those areas. And consequently, the strategy which we are launching today is a strategy for an organisation which is both competent and confident in delivering its mandate. In addition to preparing this strategy, we have also been engaged in key strategic initiatives to strengthen our capacity to deliver. We're implementing a comprehensive organisational review, which will facilitate a new occupational health division. We have prepared the first national strategy for accreditation, which the Minister just referred to. And we're implementing a totally new ICT system, which will facilitate analytical data and a targeted risk-based approach. These strategic initiatives, with the implementation of this strategy, will equip us with the tools necessary to deliver our mandate in occupational health and safety, in chemicals, in market surveillance and in accreditation. And in line with the organisational changes that I've referred to, you may have noticed that we've also changed our corporate logo. It's been 33 years since the establishment of the Health and Safety Authority, and we've just completed the first major overhaul of the logo to enhance the public identity of the organisation. The strategy which has been launched today sets out our strategic priorities to regulate, to promote, to influence and to accredit across our wide and varied mandate. It highlights key roles and key goals in tackling current and emerging challenges and opportunities in Ireland's workplaces, including the introduction of remote hybrid working, advancements in technology, the green economy, the gig economy, and the needs of vulnerable workers and migrant groups. The strategy commits to an increased focus on occupational health. Psychosocial and ergonomic issues will require particular consideration in the context of remote and flexible working arrangements. And while there are many benefits from remote hybrid working models for both employers and employees, such as increased participation in the workforce, attracting and retaining staff, the improved work-life balance, nonetheless, the remote hybrid working model needs to be planned to work well for both employees and employers. The authority has already developed comprehensive guidelines and will continue to provide appropriate support in line with government policy. The continued growth of the gig economy is a key factor across most industry sectors and will be a focus of our strategy. And we're also aware of the need to support and target the needs of migrant workers. Our workforce is ageing. Many workers are likely to face longer working lives, longer exposure to hazards at work, and a changing work environment. We must ensure safe and healthy working conditions throughout the work life cycle, and the authority will focus on this as a key area over the course of the strategy. I firmly believe that the key to positive relationships in the workplace is good communication and close collaboration between the authority and stakeholders and between employers and employees. The authority is committed to ongoing communication and collaboration with our stakeholders at corporate level. At workplace level, the appointment of safety representatives facilitates high levels of genuine collaboration and communication and contributes to the overall objective of safe and healthy workplaces for all. Over the course of this strategy, we will promote and drive the effective implementation of the safety representative model. The past 2 years have been very difficult for our country, for our authority, for our economy, for individuals, enterprises, workers, and employers. While this strategy was developed in the context of the COVID-19 and the past 2 years, the experience of the past 2 years, we're also mindful of other key external factors such as Brexit, the green economy, and global economic factors, which will present challenges in future years. We're acutely aware of the challenges that face Irish enterprises, employers, and workers, and we're committed to supporting the economy to ensure the appropriate actions, advice, and guidance within our remit is available as we navigate the uncertainties ahead. In conclusion, I wish to acknowledge the work of the Authority CEO, Dr. Sharon McGuinness, the executive team, the staff, all members of staff of the Authority, particularly during the past 2 years, my colleagues on the board of the Authority, our stakeholders for their collaboration, and you, Minister, and your department for your ongoing support. I look forward to the implementation of this strategy as we continue our journey together towards healthy, safe, and productive lives and enterprises. And with that, I'll hand over to Dr. Sharon McGuinness, Chief Executive.
Thank you very much, Tom, and indeed my thanks to you and also Minister English for your comments so far on this, our 6th strategy statement. I'd also like to acknowledge your ongoing support and indeed that of the wider department and the wider board for the work of the Authority and the staff. While Minister English and the Chairperson have elaborated on our strategic priorities and indeed our future programmes of work, I'd now like to take a few minutes to maybe speak to you about how we will deliver on these across our mandates of occupational health and safety, market surveillance, chemicals and accreditation in our annual programmes of work, including the first year 2022. Our strategy statement and our programme of work will continue to take account of the ongoing requirements to address the COVID-19 pandemic and support public health and government requirements as we move forward. We will also be taking into account, of course, other issues that continue to be relevant for enterprises, employers and workers too, so that as we emerge from the impacts of the pandemic, we are all in a position to take advantage of future opportunities. Within our occupational safety and health mandate, we will address the changing needs of worker protection brought about by new forms of work and the COVID-19 pandemic, while continuing to address the traditional occupational safety and health risks associated with incidents and exposure to hazardous agents and products in the workplace. In that regard, we will continue to apply a risk-based approach to targeting of sectors, hazards and risks, whether that is through legislation, guidance or undertaking inspections and investigations. We will also continue to focus on those sectors and hazards where we see high levels of fatalities and incidents such as construction, agriculture, transport and logistics. While 2021 saw a reduction from the 2020 fatality numbers, especially in the agricultural sector, we know that continued vigilance by employers, self-employed and workers is needed to ensure that the risks, particularly for machinery or working from heights, are addressed at all times. We will be increasing emphasis in our regulations and inspections and compliance with psychosocial and occupational health hazards and risks. As has already been said, the pandemic has impacted not just the workplace, but also ways of working. And as a result, occupational health hazards and risks need to be to the fore in the years ahead. Most of the health hazards and risks that we are addressing now are not new. However, they are likely to increase in relevance because of the nature of how and where we are working now and in the future. As we move, for example, to remote and hybrid working, employers need to ensure that no matter where their employers work, that a risk assessment has been completed and that measures are in place to reduce the risk of ergonomic injury, for example. We will, of course, continue to support and provide input to the government's implementation of its remote working strategy and associated legislation. And in doing so, we will be ensuring that occupational safety and health best practice is maintained as the world of work changes. We will increase the visibility and promote the uptake of our supports and advice for employers and workers, including future workers, through our contact centre, that's formerly known as the Workplace Contact Unit, Chemicals Help Desk, as well as reviews and updates to our website, publications, e-tools, and educational programs. In providing these supports and tools, we will take account of the specific needs of particular sectors and SMEs to ensure they understand their legal obligations to keep workers and workplaces healthy and safe. Some of the guidance that we aim to publish in 2022 includes, for example, advice on farmers as clients in construction projects, advice for laboratories using biological agents, and advice in providing hearing checks and audiometry. Mention has already been made of the impact of the pandemic across all sectors, and we know, for example, the impacts in particular sectors such as healthcare, meat and food processing. Such sectors will continue to be prioritised by us over the lifetime of the strategy to ensure that employers are meeting their statutory obligations to keep their employees safe and healthy. In 2022, for example, we will complete a review of the safety and health advice and guidance available for meat processing plants. As has been mentioned by the Chair, we will be addressing the particular requirements of safety representatives, vulnerable and migrant workers by ensuring that the guidance, advice and support to them and their representative bodies is made available in clear and easily accessible ways. We will also continue to provide educational resources to the formal education system for both young and future workers. As our chairperson mentioned already, delivering on our strategic priorities and goals, collaboration, communication and engagement with government colleagues and stakeholders remains central to how we will achieve our vision of healthy, safe and productive lives and enterprises. This collaboration and shared commitment has been evident throughout the pandemic, and I would like to take a moment to acknowledge the role and support of colleagues across all the different government departments and agencies, as well as with the employer and employee representative groups, whom we have worked with closely to ensure that workers remain safe and workplaces could continue to operate over the past 2 years. This shared commitment and this continued commitment will be to the fore as we implement the objectives, for example, of the Farm Safety Partnership Action Plan and the Construction Safety Partnership Action Plan. We will also continue to engage and partner with, for example, the Road Safety Authority and Garda Síochána and other key stakeholders on work-related road safety priorities outlined in the recently published Road Safety Strategy. Within our chemicals mandate, we will, as the National Competent Authority and through our active participation in the European Commission and the European Chemicals Agency committees and working groups, support the Minister and Department of Enterprise, Trade and Employment in the development of new policy and legislation, with a particular focus on the review and the update of the EU REACH and CLP regulations, which are a priority of the new European Chemical Strategy for Sustainability towards a toxic-free environment and a fully functioning circular economy. This chemical strategy is just one part of the wider EU Green Deal and has two objectives, namely to better protect citizens and the environment, but also to look at boosting innovation for safe and sustainable chemicals. As the Market Surveillance Authority for Chemicals and Industrial Products, we will continue to support and advise businesses importing products from Great Britain as they work to meet EU regulatory requirements and product standards following the UK exit. We will also provide guidance and advice to businesses to ensure that they understand their requirements for placing safe products on the Irish market, and we will raise awareness amongst consumers and workers to highlight the importance of ensuring that chemical and industrial products are safe before purchase or use. I'm also pleased that arising from an objective under our previous strategy statement, we will be soon publishing a national strategy for accreditation 2022 to 2026. Accreditation is an essential enabler for trade and facilitates market access for Irish products and services. It also provides confidence and assurance to consumers and service users that the products they purchase or the services they use are of high quality and meet the necessary standards. Through the Irish National Accreditation Board, we will implement the National Strategy for Accreditation and deliver the vision for accreditation to be recognised as central in providing trust and confidence in Irish enterprise, trade and public services. Underpinning all of these different strategic priorities of regulate, promote, influence and accredit, we also have one other very important strategic priority of how we work. In this regard, we will continuously improve and transform the way we work through people, processes, technology and innovation. Following an extensive reorganisation exercise in 2021, we will continue to build our organisation in a manner that allows us to deliver most effectively across all areas of our broad and varied mandate. This work has been undertaken to support the establishment of a new division, which will take the lead in occupational health and related matters. This reorganisation has been supported by government funding and will allow us to increase resources and equip and support our staff with the necessary skills and tools to manage the increased areas of focus and deliver quality services. In recognition also of our overarching goal to become an evidence-based, data-driven organisation, this year will see significant progress in the development of a core ICT platform to support the delivery of our occupational safety and health, chemicals and market surveillance mandates. It will optimise our core business processes while enabling future access to accurate, complete data and better insights. These advances will allow us to become ever more agile and deliver our services in an innovative, dynamic and user-centric manner, while making better use of information technology and providing new and easier ways to interact with the authority for those of our stakeholders. In conclusion, I would like to thank the board and staff of the authority for contributing to the development of this strategy statement and for working on its implementation through the first programme of work for 2022. We are all looking forward to working with you and our partners and stakeholders to realise our vision of healthy, safe and productive lives and enterprises in Ireland over the coming 3 years. Finally, I would like once again to thank Minister English and the Department's Secretary General, Dr. Orla Quinn, and her very able team for their ongoing support for the work of the authority. Before I stop and hand back to my colleague Kevin De Barra to open up the question and answer session, I'd like to close by paying a special mention and giving a note of thanks to Kevin Buckley, our Senior Inspector, who acted as Project Manager for the delivery of the strategy on our behalf. So thank you very much, and over to you, Kevin.
Many thanks for that, Sharon. So I'll remind you all to start with that your question and answer function is down in the bottom right-hand side of your screens. So feel free to raise your questions through that written channel and we will address them then to the panel. So we have a number of questions already in with us. So the first one, I suppose, is sectoral specific, but I suppose over the course, the stakeholders that we have online at the moment have obviously come through a very challenging period and lots of various different challenges across various sectors. We have somebody pointing out to us that our first strategic priority is to increase the focus on compliance through risk-based legislation, inspection, surveillance and enforcement. And the first question comes in relation to surveillance, and specifically it's in relation to the construction industry, but it's probably a question we can widen out to other industries as well. And it's for yourself, Deputy Minister. It's for in terms of supports from the department for the HSA, will there be additional resources? And it's specifically asking, will there be additional resources in relation to inspection, specifically for the construction industry? So we might put that one to you first, Minister.
Thanks, Kevin, and thanks for the question. I'd say if you ask Sharon, that should tell you she always wants more resources. So I think the answer to that is, of course, part of my job here is to work with the department and across government to find additional resources as are needed by the HSA. And I think Sharon manages, I would say, the budget extremely well over the last couple of years through a very difficult time with COVID, with Brexit. While there has been additional money over the last two budgets, I know the HSA could always do it more, could spend more. There is a time lag though, and also finding the skills and the right people you need for your inspector team and to develop that team as well. So if the money can be allocated, there can be a time lag too. But yes, part of our effort will be to continue to reach extra funding for the HSA, building on the last couple of budgets as well, because I recognise the importance of investing in that team of inspectors and experts who can absolutely make industries aware that they're out there and their presence is felt and that they will be having compliance checks. But I would again say to everybody that even when you look at the COVID inspections, the teamwork that has happened across all the various agencies and coordinated very often by the HSA, there was quite a lot of inspections carried out in relation to that one matter. And again, compliance is extremely high. And I think that's quite common in most cases too. But yes, in relation to resources, that's my job to continue to build on that. I know Sharon, of course, will always need more on the team, and Tom will be shy about banging for more money as well. So we'll keep on that. But definitely it's an important one, and thanks for the question.
Thanks for that, Minister. And then Sharon, a question for you. You mentioned in your speech there the organisation becoming an evidence-based organisation. So when it comes to the broad mandates that the organisation has, that the authority has, what does it mean to be an evidence-based organisation, and what will that look like into the future?
Thanks, Kevin. I suppose in terms of evidence base, we obviously have, as you say, different mandates in that regard, and we have different systems for collecting information. And information, when it comes to us, comes in lots of different formats. So we can, we can garner information through our inspections or investigations activities. We can get information in through our contact center, or as it was formerly known, the workplace contact unit. And what it helps us, and we can get it, of course, by engaging with partners and stakeholders and other groups. But what we need is, I suppose, an ability to collect and collate that information and really look at it and analyze it and determine, are we doing the right things? And if we are we seeing results? And if we're not, is there a need for us to tweak the way we approach things? So every organization across every I think sector, and every public sector in particular, we are moving to the data-driven element. And for us, it will be a means that we can get information in, that it makes it is easier for us to collect it, collate it, analyze it, and make it available to those outside, so that we're quicker at responding to maybe risks that are coming down in a sector that we might get we might get early warnings of. We can advise you accordingly by updating guidance or changing legislation or addressing things. So it's about being more, I suppose, responsive, quicker to be responsive, but doing it on the basis of information that is absolutely correct and that we can work with it. So we're looking forward to that. As you said, we've started our kind of project on that in terms of the business transformation and the ICT services. But it'll also mean that as we engage with people over the next 3 years, we'll also be looking at different ways to collect and engage on an information basis too.
Okay, thank you very much for that, Sharon. And I suppose in keeping with the strategic priorities and the strategic priority of promote, the strategy sets out to continue to increase visibility and encourage the uptake of the authority's online tools, its resources and its services. So in relation to, I suppose, that customer interaction or the use of online tools, it's probably BSmart is the one that our stakeholders would be most aware of. But Sharon, what is the plan in terms of the online tools?
Well, as you said, BSmart is one that's there, but we have a lot of others. We've farmsafely.com, we've HSA Learning, and we also have Work Positive, which is our risk assessment for psychosocial and stress matters in an organisation. So for all of those, we definitely will be continuing to use them. We've just updated our whole system on BSmart so that it is now up to speed in terms of IT capability. We'll continue to evolve it and make sure that they're responsive to the needs of what our stakeholders need. So we'll be making sure that the right business sectors are in there, the right workplace kind of work activities are covered. And we are going to be encouraging people to use them. And something like, say, for example, Work Positive, it's been around for quite a number of years. And I know our organisational psychologist, Tricia Murray, would be very much promoting that, and we would do it ourselves. But this is now a tool that all organisations should be starting to look at and really use, because, as I said, psychosocial is an area that's becoming more relevant for everybody. We certainly have spoken an awful lot more about the stresses of work, and particularly work through a pandemic. But equally, there'll be an opportunity to that as we move out of the pandemic. So between that and also our websites, and obviously our contact centre, which deals with thousands of queries and has done over the last 2 years as well, in particular in COVID, we want to make sure that, as I said, all of that information, that we give it back out to people in a manner that's usable. So we're going to have everything integrated and working forward on it. But yeah, there's always opportunities for more tools, but now we'll be making sure that those are there. They're being used right across the board. Everybody knows about them, and as many people as possible are using them.
Okay, thank you for that, Sharon. Another question that's come into us here is about the role of the safety representative, and I suppose the role of the safety representative is at the core of this strategy. But it's a role that, I suppose, it's there in legislation and it's been working well for quite a while. So this is a question we might put to Sharon, but equally, if Minister English or if our chairperson Tom Coughlin would like to comment, feel free to do so. So the question in particular here is about attracting worker safety representatives into the roles, and the person asking the question here is also mentioning the challenge of victimization of safety representatives. So we might come to you again on that one, Sharon.
Thanks, Kevin, and thank you for the question. I suppose in relation to safety representative, I mean, it is there in enshrined in legislation, and we would have a lot of, I suppose, material in respect of what the role of a safety rep is, and obviously it's something we also look for when we're out inspecting. Our work over the next few years will really to be work with both employees and employer groups to make sure that that the role is fully understood and that it's stood up where absolutely essential in sectors and in companies. But equally, we want to maybe look again to how to encourage people to step forward into roles such as this, because let's be honest, it's not always easy to take on maybe an additional task in your job. But we want to make sure that we've given the potential candidate for safety rep as much information as possible. If there is, I suppose, roles such as concerns about perhaps the way the safety rep is being the employer is dealing with the safety rep, then obviously that needs to come to the fore. And we have our contact centre, and that's one first route that people can come to. But perhaps through these conversations over this year and over the next 3 years, we can look at that and make sure that we're doing everything possible to prevent that and make sure that all sides are working on this. And if I may kind of talk a little bit about COVID and the experience, we had a function called the lead worker rep under the work safety protocol. And I think without that and that engagement between employers and employees, if that had not been there and a strong will on all sides to make it work, I don't think I don't think the protocol and the levels that we've seen over the last 2 years wouldn't have been possible. So I think something like the safety rep, it's absolutely essential for all sides, and it should be seen as a positive for communication, engagement and collaboration, which we talked about, not seen as a negative. And I think it's really important that we get that at the end of this strategy, that's where it's seen.
Thanks for that, Sharon. And Minister, your department is currently spearheading the remote strategy, so the remote working strategy, the government strategy in that regard. How do you see that influencing the world of work, but also occupational health and safety into the future?
Sorry, Kevin. Yeah, and just on the previous question as well, just in relation to the safety officer position, again, I think a lot of what Sharon and the team and Thomas, Chairman, were talking about, a lot of the work of the HSA is try to encourage a culture in our work environment. It's not just always about catching somebody out or the inspectors. It's actually education and encouragement to do the right thing and develop that safety culture within your workplace. And I think that's why I think it's important that there's the right culture behind that supports the role of the safety officer, and that's key. I think we all know, certainly nowadays, any position of responsibility doesn't make you the most popular person in the place, and that's the way life's gone. But we need to try to encourage that and celebrate responsibility and reward as best we can, but certainly support it where we can, because it is difficult for anybody to step up and take on extra duties. But certainly one that's not how it's going to make you the most popular person. So we should need to bear that in mind. But it's a very, very important position. And again, I think setting out clearly what the role is and the education behind it and supports as well. In relation to the remote strategy, I think it's nearly a year old, that strategy that was published by the Taoiseach in January last year. And the whole aim of that is to make sure that remote working becomes a permanent feature in our workforce and in our work environment. And we would have started in this department a remote working strategy and consultation around that even before COVID. But certainly it's took pace because remote working has taken off as a concept, but certainly has been proven as a concept for a lot more, that it is an option. And we would like that option to remain when we get through COVID as well. A lot of employers and employees are still working through this conversation. We all know the early months of remote working were very difficult for anybody, certainly trying to find a good working environment in the house, trying to manage family and everything else. But as time went on and it became more planned, it became a lot easier. And the aim of the strategy is, across the 15 or 16 different actions, is to make it easier for remote working to work successfully and to be a positive experience for both employer and employee and for the organisation. So that's the aim of that is. And I think it'll help us attract more talent and retain talent in the workforce in years to come, and bring people back into the workforce who might have left for various reasons as well. Also, from a regional point of view, it gives us that regional spread we've been trying to achieve for many years. I know from doing the planning framework, trying to envisage to encourage a population growth on the western side of the country versus the east. It's a difficult challenge. Remote working is a major help to that, along with investment as well. So that's key. But absolutely, the legislation then behind that, health and safety legislation, is very, very important, that employers are aware of their responsibilities to their staff, even if they are working remotely or wherever they're working. And more when you talk to employers, you realise they're not always aware of this. And that's really, really important that they assess where their staff are working and they support that and they work with them to make that a safe, a secure place for occupational health as well. So I think there's a lot of work we have to do there through the strategy, and a key part will be the legislation and the information and the promotion of it, which I think is a key work that the HSA would do, and the strategy sets out that as well.
Thank you for that, Minister. So I might come to yourself, Tom Coughlin, as our chairperson. It's very important for you to manage that and get the balance right between that tripartite nature of the board. So you might just talk to us in terms of, I suppose, that stakeholder management piece, but also I can see a comment here from the Safety Assessment Federation Limited that are, I suppose, asking for a specific piece that we'll follow up on offline, which is about how do you build a relationship with the HSA and how will we make you aware of policy positions and collaboration into the future. So we'll follow up on that particular piece offline. But in terms of your own role as chairperson, Tom, you have a new strategy, you have a tripartite board, and even maybe some of the topics that we've touched on there in terms of the safety representative. You might just talk to us about your own view on those.
In the context of the board of the authority, the role of the board is to exercise leadership and to drive the implementation of the policies. The board, as you say, is a triumvirate board. They're representatives of nominees of employees and employers, which are appointed by the minister, and then ministerial appointees as well. So we're very fortunate, I think. The authority is very fortunate that we have the interests of the employers, the interests of employees represented around the authority table, because it means that members of the authority board have got the fingers on the pulse of the workplace. So we understand what is happening in the workplace, and we understand the needs and requirements and the policies that to make the workplace a better place to work and a safer place to work. So in terms of safety representatives, as I said earlier, that is one of the policies that we will be driving going forward in this strategy, and it is something that comes up regularly for discussion at board meetings, so I'm sure that will continue. The role of the board, it's in relation, as I said, to performance, to driving the implementation of policies, but also very importantly in relation to conformance and to ensure that we comply with governance requirements. It's a very important element of the board's work as well, and we're very conscious of the need for compliance, and as I said, with the compliance requirements in the governance codes. You mentioned communication with the authority and building up communications and relationships with the authority. I think that, in my experience, that shouldn't be a difficulty for any organisation or body. I find that the authority, the executive, chief executive, staff are very responsive, and I find that communication within the authority is very good. It's at a very high level, and I think that particularly over COVID, there was a sense maybe that the authority was a regulator and couldn't really engage to a great extent with employers and with stakeholders. But I think during COVID in particular, we found that we have engaged more. We've entered into a number of memorandums of understanding, the service level agreements with various organisations and bodies. And I think that our communication is wider and deeper now than it was pre-COVID. I suppose there are some positives to come out of COVID, and that is one that, we have had to engage more, and I think that has worked very well. So I think that the question that you raised there about communication and building relationships with the authority, I don't think that should be a problem. In fact, I'm sure that it won't. The authority is very responsive and very communicative.
Thanks very much for that, Tom. Just a final question for yourself, Sharon, and it seems that the evidence-based piece that you mentioned earlier on is sparking a couple of questions. So a question here asking, how can the authority use information systems to be more targeted in its approach into the future? And I suppose that the specific question there is really about having a database of workplaces and what that might look like. But you might just talk to us about how we can be more targeted in our approach.
Yeah, thanks, Kevin. I suppose as I see those questions, I guess there's different ways of working in that regard. Obviously, we do have our own bank of information, and collate that as we go, and again looking at it and being able to analyze where perhaps particular risks or issues are arising in sectors and employers across the board, and that will be, you know, I suppose the ultimate aim in the future with our new business transformation, our new ICT portal or model that we're moving to. The other point I would say is in terms of, you know, finding out about data, you know, who's there, who's in business. There's lots of different ways to do that. We can work with collaboratively with other organizations and try and share, I suppose, collectively information about employers or workplaces, but equally there'll be opportunities in the future where the central government are looking at maybe having a more collated system for business identification and being able to identify people from a business perspective. And that's something that as an organization, as we develop from our business, you know, in transformation into our new ICT platform, we'll be looking to maybe build on that and be ready to avail of that as soon as it's available. And I think that itself will be a really positive opportunity. But I think, as I said, in terms of all of the different ways we're collating, and we intend to collate and work across synergistically between all our different mandates on occupational health and safety, chemicals, market surveillance, we will be building up a much more comprehensive picture and be able to map and analyse across all of those different sectors rather than trying to focus on any one issue perhaps currently. So yeah, we're looking forward to that. But it is an issue and one we're very recognised we're looking to resolve.
Thanks very much, Sharon. So to wrap up, we might just wrap up by, first of all, thanking the Minister for State for Enterprise, Trade and Employment, and Tara Damien English, for his time today, but also for his support in launching today's strategy and the ongoing support by the Minister and also of his department and his officials in relation to the support for the HSA. I'll also thank Tom Coughlin, the authority's chairperson, and Dr. Sharon McGuinness, the authority's Chief Executive Officer. Our strategy is now formally launched. It is available on our website. There's also a programme of work for 2022, which gives, I suppose, a very detailed piece of exactly how we're going to achieve those outcomes that are there within the strategy. Hopefully we've answered your questions today, but if there are any questions that people still have that have not yet been answered, don't be afraid to get in touch with us. Contact us at hsa.ie is the best way to get in touch with us. And again, our míle buíochas líb go léid, and we'll be coming back and seeing a lot more about the delivery against this strategy in the coming months and years. Gur míle maith ar fad.